Hi everyone, I'm Dr Dmitry Klokol, Chief Medical Director for European Wellness International Centers. And I'm talking to you today from this office and studio of the Global Medical Education Organization. You know that our group, our medical facilities and our research and development facilities are all dedicated to anti-aging, disease prevention, disease reversal and age reversal. But today, at this moment, our topic is a pandemic. We all have the pandemic going on out there, hitting all the countries, almost all continents, all over the world. What it means, it's an outbreak that went to the level of epidemic, and this epidemic has involved almost the entire globe, entire world. That's why we call it pandemic. And the factor that the antigen, the bug that is causing that, is called SARS coronavirus 2. That's the name of the virus that is causing disease known as COVID-19. So although we know that about 80% of people are going to recover, they're going to go through flu-like or some common cold symptoms, they're not going to deteriorate, they will recover eventually. However, 1 in 6 may become seriously or critically ill, and we have about 2% on the average. We don't know how bad it is yet, can be 1, hopefully it's as less as possible, but it can be worse. So around 2, maybe 3% mortality, means 2 to 3 people out of 100 people will die. But the problem is that this virus is so tricky that it affects predominantly elderly people, people who are 50 years old and older, and the death rate, mortality grows exponentially in different age groups. So in the group of people who are 70 or 80 years old and above, the mortality can be as high as 25%. It means 1/4 of our old folks, our grandparents, great-grandparents, once they contract this disease, they may have very severe symptoms and they may eventually die. Although who are other people who are at risk? Patients with underlying chronic age-related conditions such as hypertension, diabetes or pre-diabetes, metabolic syndrome, anyone with a high blood sugar and increased ACE2 receptors, virus is choosing those as his victims and attacking those people, as well as people with a chronic obstructive pulmonary disease, chronic lung disease, and people with weak immunity. So all those things that we have been telling to our patients for all these years and decades: take care of your health, improve your immunity, get rid of the high blood sugar, get rid of your metabolic syndrome, control your blood pressure, take care of your entire body. That all was very real. And this current situation tells us that a lot of things should have been done in the past, but it doesn't mean that we have to panic now and not do anything. We have to continue doing what we're doing. So patients or people, individuals who contract this disease, they may develop, and they will eventually develop, some of the symptoms such as high fever, chills, they will start coughing, shortness of breath, they may have short, dry cough, or they may have a productive cough with a sputum. Some of them may have diarrhea, some of them may have conjunctivitis, inflammation in the eye, and these other symptoms, So important to remember and to know that there can be a large number, and probably out there is a huge number of people who are already infected. Maybe they're carriers and they don't even know about it. They may have very mild symptoms, or they may have no symptoms at all, or maybe they are yet to develop symptoms. However, they have already contracted this virus, because the latent period can be as long as 9 days and maybe even 14 days or 10 or 11 days. We don't know yet for sure, but we have to be prepared for the worst. What it means: you may be a carrier of the virus and you will be spreading this virus to other people out there, to your loved ones and your families, at home or anywhere you go, in a supermarket, anywhere, without even knowing that. So, what has to be done? First of all, we all have to protect others and protect ourselves. We know how to protect ourselves and others with hand sanitizers, with masks, gloves, and remember, masks and gloves have to be single use. Use it once, dispose it because it may be contaminated with virus. Make sure that you wash your hands regularly and use the hand sanitizer, but that is not enough. You need to get tested. It is very important that you know your status, whether you have bug or you don't have this virus. And it's also very important to distinguish between the early phase of the disease, or maybe you are already a recovered person, so you're in a reconvalescence period. So those things are also very, very important. So what do we have? What tools do we have for that? The number one, we can test for etiology or for the antigen itself. Yeah? So the polymerase chain reaction, the PCR test, will tell you whether you have the actual virus now circulating in your system. There's also another test, so-called the serological test. The serology will tell you to what extent your immune system, once encountered this virus, has already started working. And for that, we have immunoglobulins M and immunoglobulins G, which appear at different phases after you contract the virus. The immunological test that is used for detection of these antibodies is called Eliza Test. Some data says that Eliza Test, the presence of immunoglobulins, the antibodies in your blood, can appear about after 7 or 9 days after the onset of the disease. However, there is some data stating that as fast as within 3 to 5 days from the moment when you contract the virus, you may already have these immunoglobulins positive. And that's very, very important to know. And another thing that is very important to understand, that different tests, different manufacturers, probably they may be of a different quality, so the different sensitivity and the speed at which you will get a proper, correct result will also may be different. So those things are also for us yet to find out. Now, where do we stand at this moment? Come here. I'm going to continue here. Now, if you will use the test that I'm talking about, that will appear in the end of this video, and you're going to do the serological examination, how fast can you get the result? Very fast, within 10 minutes. 10 minutes. And you may know what your actual status is. That's very fast. Now, where can you do that? Essentially, you can do it anywhere. That's why we call it home use. Of course, you can do it together with your medical practitioner, with your family doctor, with your doctor friend or nurse, anyone. But this test even comes with a very specific step-by-step instructions. Very easy to understand. As long as you can read, you will be able to do it yourself. So within 10 minutes, anywhere, that's why I call it home use, you can get a result. Now, sensitivity. 95 to 96%. What does it mean? It means that if you are positive, if you really have this virus, out of 100 people, 95 to 96, it will give you a correct, accurate result. So that's sensitivity, 95 to 96%. Why I put here 95 to 96%? Again, because remember we have IgM and IgG. Okay, so one will show you 95% of cases, another one in 96. There's always a transition in your immune status as the time progresses. Now, specificity. How accurate is this test that you are testing for the right virus? The specificity, the accuracy is 96.8%. This test will also show you that, for example, you do not have disease. So when the sensitivity talks about how accurate in testing positive, so this will tell you how accurate and correct this test is if you're negative. Okay, so if you don't have this virus, with an accuracy of 96.8%, it will show you correct results. Now remember, you can do it at home. You can do it as fast as within 10 minutes. Hopefully that within 3 to 5 days, unfortunately maybe a bit longer, you can get correct results. So take care of yourself, take care of your loved ones. You have to know your status. Even if you're negative, or even if you had already coronavirus before and you recovered from that, you're in a great state of health, you have fantastic immunity, you have overcome that, but it's better if you know what is the status of your immune system. Are you protected in the future or not? And please remember, protect yourself, protect others. We're going to come out of this pandemic stronger than we were before, okay? So, Dr. Dmitry Klokol here with you all the time. Thank you very much. Stay healthy and strong.